Well, good morning, everyone. This is Keith with Positively Osceola. And on this beautiful Wednesday, can't think of a better thing to do than spending time with people in the community that are actually making a real positive impact in and around Osceola County and certainly the Central Florida region. And so often in Positively Osceola, we get to really kind of brag on the folks that we are honored to be able to speak to and really share extremely important information with the community. And we don't take that lightly that we get to do this so often. And today is going to be another day where we are super excited to have somebody join us that is just doing a great job in keeping people healthy, saving lives, and again, serving the community. And today we want to welcome Dr. Anil Singh from Orlando Health. And so welcome. Good morning, Doctor.
Thank you. Thank you for inviting me, and thank you for your audience and viewers for tuning in.
We're glad to have you. We'll keep it casual for a few seconds here. Let people figure out that we're here this morning. I'll brag on you for a second and give you a little. We'll give you a little intro once we open this up and official. So beautiful Wednesday, and we were talking earlier. So you've been in St. Cloud a couple months now, right?
Yes, I started in beginning of January, so it's almost 3 months, and I enjoyed working here. Before this, I worked in West Virginia, where I was teaching residents and also doing practice in gastroenterology.
Awesome. A little warmer down here.
Yeah, definitely warmer.
Well, if you've been down here for a couple of months, you enjoyed some fair weather, while some of the other folks were getting little hit up north with some cold. But so we're actually getting some folks popping on right now. So if it's okay with you, I'm going to kick it off here and make it official. Is that okay with you?
Yes, I'm ready.
All right, here we go. Well, again, we are here with Dr. Anil Singh, and I'm going to give you a little more introduction at this point. So, Dr. Singh is a board-certified gastroenterologist at the Orlando Health Digestive Health Institute with more than 20 years of experience. He's skilled in endoscopic procedures and has special interests in inflammatory bowel disease and irritable bowel syndrome. Dr. Singh received his medical training at Patna Medical College in India, completed his residency in internal medicine at the University of Medicine and Dentistry of New Jersey School of Medicine in Newark, where he also performed his fellowship in gastroenterology. Fellow of the American College of Gastroenterology, Dr. Singh is double board certified in internal medicine and gastroenterology. Before moving to Florida, he practiced in the mid-Ohio Valley metro area. Outside the clinic, Dr. Singh enjoys golfing, jogging, and watching movies. So do you enjoy golfing more or jogging more?
I enjoy golfing more, obviously.
Good answer.
It's part of my exercise.
Well, I think golfing is certainly a little more peaceful than jogging.
Yeah.
No question about it. So again, welcome, and we're really super glad you're here this morning. Going to touch on a subject that I just don't think we talk about it enough. I'll be personal, and I just don't think we talk about it enough, and it's extraordinarily important for sure. So I'll just go right at it because I think you got a lot of great information to share this morning. So if you would just tell us a little bit about yourself. I know I spoke about you before, but just tell us a little bit about yourself and experience as a gastroenterologist, please.
Yeah, so I have been in practice for 26 years, as you said, and before this, I was in West Virginia, and we were teaching residents there. I also enjoy endoscopy and taking care of patients for gastrointestinal conditions. And as you are aware, this is Colon Cancer Awareness Month. March is Colon Cancer Awareness Month. and we like to inform people about colon cancer. This is a cancer which is very common. It's second leading cause of cancer death in both men and women, and up to 160,000 people make it die from it. So right now we are interested in, increasing the screening for colon cancer, and currently only 70% people have been screened. So we want to increase to 90% or even higher. And in our county here, screening is even lower. So our goal is to increase it so we can prevent colon cancer or find it at an early stage.
That number was surprising to me. It seemed like you'd think it would be higher by now. So yeah, I guess I'll wait a little while to get into some personal side. I know that not only a year ago, we lost my brother-in-law to this particular disease, and that probably has increased my awareness of how little we talk about it sometimes as a culture, certainly in America. I know we certainly, I would think from a layman's perspective that certainly we've done a better job maybe over the last 10 years or so. But I still think there's a lot of work in awareness. So again, I appreciate you talking about this morning. So you kind of went towards this a little bit, but what other diseases other than cancer, what other diseases do you commonly treat in your practice?
As a gastroenterologist, we treat conditions related to intestines, stomach, pancreas, and liver disease. So it can be symptoms related to abdominal pain, diarrhea, nausea, vomiting, difficulty swallowing. So any kind of rectal bleeding. So we treat all gastrointestinal conditions. And even though it may sound like gastrointestinal diseases are not that common, this is one of the most common diagnoses for patient visiting doctor offices. And some of them, they need to be referred to gastroenterologists because they have more complicated problem, or they need to have endoscopy or expert opinion. So we take care of patients with liver disease and pancreatic disease and ulcers, gallbladder problems, and also patients with colitis or irritable bowel syndrome.
Mhm. And I'm going to assume I may be incorrect. So is colonoscopy, is that where primarily you're discovering the diseases that you end up treating? Is that the primary testing that's going to reveal what you just talked about?
No, we do different kinds of testing. Colonoscopy is one of the tests we do, but we also do endoscopy of stomach. We do biliary endoscopy and also ultrasounds. Of course, we do blood test and other testing, including capsule endoscopy, which is a test we do to check for small intestine diseases, which is where you swallow a camera and it checks your small intestine for any problems.
Understood. There's a reason why I asked that. I'll see if I can lean to it a little bit later on. But let's stay on the colonoscopy. Why don't you, for those who don't know what that particular procedure is and the basis of it, I guess, go ahead and explain colonoscopy, please.
Yeah, so colonoscopy is basically a test to check for your large intestine. As we know from our uh, as, knowledge from before, that we have a stomach, then we have a small intestine, and then we have large intestine. So when we eat, food goes into stomach and then goes to small intestine, and then it goes to large intestine. So large intestine is also called colon.
Okay.
So the reason we are interested in colon because it has risk of getting colon polyps or cancers. So we have found by studies done over many years that if we can remove colon polyps, which are growth inside the colon, we can prevent colon cancer. So the one way we do it is by colonoscopy. So colonoscopy is a test where you take a prep, which is a little uncomfortable and not really fun, as most people who had colonoscopy will know. But then the test itself is not painful. We usually use sedation, and people are not having any pain during the procedure, and most of the patients will not have any pain after the procedure.
So the part you referenced that was the least convenient was certainly is the prep, for no doubt about that, right? Preparing for it.
Mm-hmm.
But certainly the outcome certainly makes it worthwhile. So I mentioned earlier that I probably would make it a tad on the personal side. So my mother is currently 91 years old. And in her early 60s, they discovered she had one of her, a polyp that was cancerous. And so she took care of that. And obviously that was successful as she is 30 years later. And what that led to for everyone in the family, all the kids, we were recommended to go get colonoscopies at an early age. So I did that, certainly relatively quick afterwards, and then had another one. So can we, and the reason I bring that up is, can we talk about the length from where we are now in studies, from what we know now? What do you recommend people as far as the frequency? So what is the early age? What is the age you recommend currently? Because I know that changes. And then once somebody does have a colonoscopy, if they do have a family history and if they don't have family history, what is the current recommendation for colonoscopies?
Yes, that's a very good question. We had initially the starting age at 50, but recently it has been decreased to 45. So patients who do not have any family history like you will start at age 45.
Okay.
And the reason for reducing the age of screening was because we are seeing more patients with colon cancer at an earlier age. So it is shifting more downwards to patients in 40s or early 50s. So normally you will start at 45, but if you have a family history, you probably need to start at 40 years or 10 years younger than the relative at the age that your relative had colon cancer. Frequency is usually not very is every 10 years if you have normal colonoscopy, but if you have polyps or growths, then it can be 3 to 5 years from your first colonoscopy. So for most people, they will not have polyps, so they will have colonoscopy every 10 years.
Gotcha.
In your case, of course, you are a little bit higher risk with your mother having colon cancer, so it will be less, maybe every 5 years between colonoscopy.
Gotcha. And so as I said, I had thought about every 7 or 8 years was going to be something I kind of put on my own personal schedule, and I'm at that place again. So I'm going to I'll schedule another test relatively soon. Personally, it's never been that challenging. I just thought, probably because my mom did have a cancer result, that it certainly motivated myself to take care of that. Now, on the other side of my family, I had a brother-in-law we lost last year because he just, it's easy to say it now, but he put this off a little bit long. So by the time they discovered the issue, it was much more intense than you would have hoped. So how do we, how do we help you better to communicate to people that this is a cancer that, if detected early or even pre-cancer, it's such a different outcome, correct?
Yes, so our goal is to not only detect at early stage, but also prevent you from getting colon cancer, because this is a cancer where there is precancerous polyps, and if we can remove them at a polyp stage, you don't need to have surgery or chemotherapy. But even if you don't pick up at a polyp stage, if we pick up at early colon cancer stage, the prognosis is very good, up to 95% survival.
Excellent.
But I think there are some myths in the communities which reduces the risk of screening. Some people think just because they don't have family history, they are not going to get colon cancer, which is not true. Actually, most people who get colon cancer do not have a family member with colon cancer, but they are the first one. So, because it is a common cancer, we need to screen everybody at 45-year age and older. Other myth with colon cancer is that if you don't have any symptoms, you're okay. So we get patients who say, I'm feeling fine, I don't have problems, I don't have a family history, I don't need to get it. So our goal is to do it before you get symptoms, because by the time you get symptoms, your cancer may be advanced, and early colon cancer may not give you any symptoms.
Understood. Just something that came as you were speaking about that. Do you find statistic wise that men or women are more likely to have colon cancer or colorectal cancer? And are there certain ethnicities that are more prevalent to having colorectal disease at all?
I think men are a little bit higher risk in the beginning, but as women also catch up at a later age.
Right.
So because women live longer in general, so they do catch up with time. So women also need to get colon cancer screening as much as men. Uh, of course, women are more into screening because they're getting mammograms and all that, and they are more health conscious. So they are more likely to get colon cancer screening, I think, than men. And also, they have a role in pushing their family members to get screening, because I see a lot of men coming in because their wives have sent them, or girlfriend push them to get it done and say, you better get it done. So I think family pressure and recommendation plays a big role, because there are a lot of notions about this screening, that because it involves going through your rectum and people don't want to talk about it,
Sure.
it reduces the risk, reduces the screening incidence. As far as ethnicity, African Americans have a higher risk than Caucasians. So they need to sometimes get screening even earlier, and sometimes we start at age 40 for them.
And if I'm correct, I think insurance wise, it's certainly in the United States, it's much more of a well care scenario now than it was maybe 10 years ago. I think that's probably true in most cases, but I'm not an insurance person, so I don't know. You know, I've been to my mother. I was on the phone driving to the office today, and I explained to her that I was going to be speaking to you. And immediately, just as you had said, she said, well, you're going to be making yourself an appointment, young man. So I think you're right. I think it seems to be that women are maybe a tad bit more health conscious, and certainly make those recommendations to us stubborn guys a little more often. Anything else you want to share about this that we haven't talked about yet this morning?
Uh, as far as colon cancer, I will like to let people know that even if they don't want to have a colonoscopy, it's better to talk to your doctor, because there are other methods you can have colon screened. So we have a stool tests available, and that can be done in doctor office, and it checks for blood. And then there is another test called Cologuard, which is a stool test, and that checks for precancerous polyp and cancer. Even though it's not a gold standard, if you're not going to have any test done, it's better to get something done and get started and get thinking about it. Because if your stool test shows some abnormality, then you have more reason to get a colonoscopy done. So that will increase the incidence of screening, so people can people can start thinking about it. So if you don't like the thought of colonoscopy, maybe talk to other people who have had it, and they will say that it's not a bad experience.
Sure.
It gives you a peace of mind.
Yeah, I can actually attest to that for sure. I think as a culture, we tend to talk about that being such a big test, but in reality, it's not. And you're right. I think the value of that peace of mind is far outweighs anything else that you have to do to take that test. You meant before we finish this out, I want to ask you. So you mentioned obviously waiting to a point where you're experiencing symptoms is not the perfect scenario. But if you would, for those who might still experience some symptoms, what would those symptoms be that people would experience who would say, okay, that's it. I'm calling a physician today. So what would those symptoms be?
Yeah, if there are symptoms, then you definitely want to have a colonoscopy or whatever test is necessary. So main symptoms for colon cancer will be blood in stool. So if you have blood in stool more than usual, you should get checked for colon cancer screening. Other symptoms are abdominal pain. So if you have persistent abdominal pain more than just a little bit, or you are losing weight, that's another sign of colon cancer. Uh, if you are feeling fatigued and tired all the time, that could be sometimes sign of colon cancer, because in some people it'll make them anemic by losing blood, and then they can get checked. So these 3 or 4 signs are for the colon cancer, but like we discussed before, most common sign is no symptoms. So most people we see with colon cancer do not have a symptoms until it gets advanced. Then you will get symptoms, which is abdominal pain, bleeding, fatigue, and weight loss.
Well, you've been very clear this morning, and certainly an important procedure to have done. I thank you that you made it so clear as far as of the age recommendations. Certainly, I think people still talk about it being once you hit the 50s. I hear people still, I've actually heard some folks talking about it, well, once you hit the 60s, but as you said, it's now recommended at 45, and that's if you don't have any family history. So I think that piece of information alone, I hope people will absorb and act on. I appreciate very much that you would take the time this morning and spend some of it with us. I know you had to clear your schedule to do so, and so thank you. And I'm not to make light of anything. You certainly have a position in life that saves lives, and so we thank you for that very much.
Yeah, thank you for inviting me, and it was nice talking to you. This is, as you know, Colon Cancer Awareness Month, and we have a slogan to say, "What's up your butt? Get checked with colonoscopy." So that's a slogan to get people motivated, because this is also part of your body, and you can't just ignore it.
No, not at all. Well, I do appreciate you very much again, practicing at Orlando Health St. Cloud Hospital. So certainly an easy way to get that done if you're in the greater St. Cloud area. And again, you can call 321-841-4344. Or again, you can reach the information you need by going to orlandohealth.com. Again, today with Dr. Anil Singh, board certified gastroenterologist at Orlando Health Digestive Health Institute. We thank you very much, sir, for being with us this morning.
Thank you. Really.
Right. Again, this is Keith with Positively Osceola, along with Dr. Anil Singh with Orlando Health, together making a positive difference in and around Osceola County. Thank you, doctor.
You're welcome. Thank you.